Today I will demonstrate the proper technique of transporting a patient up or down a curb while in a wheelchair. To do so, you must evaluate both yourself, the healthcare provider, and the patient. You want to evaluate your own physical capabilities and the needs of the patient in order to decide which method is best. Then you must utilize proper body mechanics in order to ensure the safety of both yourself and the patient. Lastly, you need to educate both the patient and their caregiver in order to assume their safety for later on. There are a few safety aspects that need to be evaluated before you begin. First and foremost, you need to take a look around to ensure that no traffic is coming and it is safe to move down the curb. Further, you must ensure that the patient is obeying proper wheelchair mechanics while using the brakes when not moving and keeping their arms inside the chair and their legs in the footboarders. The first way to descend a curb is the wheelchair backwards method. To do so, you must first ensure your safety of the area around, no traffic, and then you tightly grab a hold of the handles and roll the patient so that his rear wheels are at the edge of the curb. Now the healthcare provider is going to step off the back of the curb and get in a good position to maintain. Then you are going to use your thigh to brace the back of the chair and ensure that the patient is ready to move down the curb. Are you ready?
Ready.
Then you slowly lower the wheelchair off the curb until the wheels touch the ground, while maintaining a good grip strength the whole time. Then from here, you slowly pull backwards until the front wheels are safely on the ground. The next method of descending a curb is the wheelchair forward method, and this method is less preferred. To begin, you are going to slowly roll the patient until their front wheels are at the very edge of the curb. From here, you are going to tilt them back, and you need to be sure to maintain good communication with the patient. I will be tilting you back. Is that okay?
Yes.
Okay. Place your foot on the wheelie bar and slowly tilt them back while maintaining good posture. Then you are going to slowly roll the rear wheels to the edge of the curb. Be sure to stay in a position of flexed knees and flexed hips. Then you are going to slowly lower the patient off of the curb until the rear wheels make contact with the ground. Then you're going to slowly tilt the patient forward until all four wheels are on street level. Now we will move on to a method of ascending the curb backwards. To do so, you must put the patient in a tipped position. You need to be sure to communicate with the patient so that they know which movements you are doing. I'm going to tip you, is that okay?
Yeah.
Okay. Using one foot on the wheelie bar, slowly tip the patient backwards and then slowly roll the rear wheels to the edge of the curb. At this point, you need to keep a tight grip on the chair and maintain good body mechanics with a wide stride, a flexed hip and a flexed knee, and an erect trunk. From here, you are going to pull the patient up the curb very slowly while maintaining good body mechanics, then roll him back until the front wheels clear the curb. From here, you are going to slowly lower the patient down until all four wheels are in contact with the ground. For that step, you may use the wheelie bar if necessary. Now we will move on to the method of ascending the curb with the wheelchair facing forward. To do so, we must first tip the patient back, but make sure they know what movements you're about to do. I'm going to tip you back, is that all right?
Yeah.
Placing one foot on the anti-tip bar, slowly tilt the patient back and get a good body mechanics position behind them. From here, you're going to slowly roll the chair forward while making sure the front wheels are clear of the curb. You're going to slowly roll until the rear wheels of the chair make contact with the curb. From here, you are going to get in a good position behind the chair and slowly push and lift on the chair and roll it forward until all four wheels are safely onto the curb. This is the most preferred method of ascending a curb.